Although surgery, chemotherapy and radiation are the most common primary treatments, other types of treatment may apply to your situation. Hormone therapy is often used in cancers that are sensitive to hormone treatment, such as breast and prostate cancers. Some treatments are experimental and only available through clinical trials. Studies used to help researchers understand the safety and efficacy of new treatments.
I was actually breastfeeding my youngest daughter, Demi, and she was 9 months old, and I thought I actually had some mastitis. So I went off to my local GP just to see about getting checked for it, and discovered that I actually had a lump, and went off and was tested. They said within 2 days come back to the GP anyway, so but they rang me early, so I knew straight away once they rang early there was something wrong because of the family history. So I went back to the doctor and was told then and there that it was actually breast cancer, and then she referred me to the specialist. The hard thing was because my mum didn't make it, and my mum's sister was diagnosed of ovarian cancer as well 8 years after my mum had passed away. So I guess having the family history, it was a concern, was I ever going to make it? That was my first thought, am I able to make it through the chemo? My sister had chemo of 6 months, breezed through it, not a problem. So I thought it'll be easy, I guess, that won't be too hard, and she was pregnant, so I thought, well, if she could do it, it was a positive thing for me to follow. But I did it, and the first one, I couldn't believe that I was so sick. The first night at home, the sickness I had, and I just thought, there's no way am I going to make 8 months of this. So, of course, they try you on every different drug to try to help you get over the nausea, and it wasn't until the third treatment that I actually got on top of it. So, but it wasn't easy. I found it extremely hard. I know I can remember being at a friend's first birthday party, their little girl, and I was there, and I leant over something, and I noticed a bit of hair fell out, and that sort of thought, obviously it was starting, and that was only within the week of the first treatment. So we got home that afternoon, and I was out the front on our deck, and I was shaking it, and it was falling out in handfuls. So I let it go for the night, and just thought, we'll see how we go tomorrow. And the next day I got up and it had fallen out a lot overnight, and then Dean shaved it actually for me, and being a hairdresser, and it was long, so I actually found that quite difficult. And I think the little girl, my 5-year-old at the time, she found it difficult. She cried a lot seeing me with no hair. Yeah, it was hard to get used to. It was probably one of the hardest things I found, but being in my profession, I found it difficult. But then once I got the wig, and I got the wig through my work, so that was a bonus as well. And it was great. No one ever knew, really. It was nearly exactly the same as what I had. And in the end, I didn't wear the wig. I ended up wearing bandanas all the time, and it was just as easy to wear the bandana. And in the end, I got used to having no hair, and it was actually quite easy. So, and then when it started to grow back, it was a bonus. So, still growing it now. I had 8 months of chemo, and on the very last one, because from the third one I came okay. Like, they weren't easy, but they were a lot better than what the first 3 were. So, but the last one I was still quite sick 2 weeks later, which I thought, well, the drug that they had given me, obviously my body had got immune to it and it wasn't treating me well enough. So I went off to my local doctor again and just said, look, I'm still quite ill and I'm not feeling right. So she did a urine test and everything and thought she'd send it all off to the specialist, but it came back and I was actually pregnant again. So, which was an added bonus, because we actually got told that once I started chemo, there'd be most likely that we wouldn't have children again. But I guess we'd been blessed by having the 2 girls anyway, that we thought, well, I guess it just makes it easier. We thought if I hadn't have had any, well, we could have gone into doing all the frozen embryos and all that sort of thing. But at that time, we just thought, well, no, we were lucky to have the 2, so we didn't worry about it. And then when I went to the doctor, I actually found out I was pregnant again, so it was pretty special.